Staring. 1, 2, 3, 4, 5.
Every September marks an important time for sports fans here in America. Why? Because it's the beginning of football season. We become fanatics as soon as the first ball is kicked off and we yell and scream our teams to victory. Sometimes we become a little too worried with wins and losses, and we expect the players to do whatever is necessary to get on the field and perform at a high level. The big plays and big hits are what we want to see, but we forget sometimes how taxing it can be on their bodies. Injuries occur every year, and there's not too much we can do about that, since it's a full contact sport. Bones will be broken and ligaments will be torn, but there is one injury that has sparked an interest in fans, players, and management: the concussion. The concussion is now the hot topic of the NFL today. What is a concussion, you might ask? A concussion is an injury that stems from a blow to the head or a whiplashing motion that sends your brain bouncing off the inside of your skull. In both instances, there is damage to the soft tissue of your brain, so let's call it what it is: a traumatic brain injury. Now, traumatic brain injury doesn't sound as nice as the word concussion, but it sure helps us realize the significance of the injury. These traumatic brain injuries, or concussions we call them, have been around forever, but only now are we obtaining enough information about them to diagnose them correctly. Being able to identify symptoms as soon as possible can be beneficial to the health of an athlete who has sustained the injury. When an athlete has received a concussion, it can be hard to determine if he has one or not because there isn't a standard symptom. Although concussed athletes can typically have similar symptoms like problems thinking or concentrating, headaches, dizziness, nausea and vomiting, light sensitivity, and mood changes, Dr. Mickey Collins, the Assistant Director of the University of Pittsburgh Sports Medicine Concussion Program, stated in an interview conducted by Jorge Ortiz of USA Today, "There are different subtexts of concussions just like there are different subtexts of knee injuries. If you take a blow to the back of the head, you're going to have visual change, balance difficulties, fatigue, and you may lose consciousness. If you have a frontal injury, you're more likely to have memory difficulties or attention problems, maybe some mood-related changes. Since the symptoms can be unique to each case, it is important to know exactly how the injury occurred and all the symptoms that are possible. Since concussions are such a hot topic these days, they are being monitored closely and data is finally being recorded to give us a better insight on how many concussions are occurring in the NFL. If you look at this graph, you can see the increase in the numbers of concussion cases being reported. They have steadily inclined from 2008 at 115 cases to 2011 at 171 cases. This doesn't mean there are more concussions occurring, but it does mean we're getting better at recognizing the injury. Now that we are taking a closer look at these injuries, we need to look at their long-term effects as well. The effects of concussions are usually only thought of by their symptoms that occur immediately. However, we are now seeing the long-term effects on older generation of athletes. Emotional distress, long-term memory loss, depression, and slowing movements are some of the lasting effects being reported by players who sustained concussions in the past. NFL players who have had concussions are also 5 times more likely to develop degenerative brain diseases such as Alzheimer's disease. Unfortunately, we will never rid the NFL of concussions because it is such a violent game, and as fans we always want to see the next big hit or our favorite player by our favorite players. However, the symptoms and effects of concussions are real, and these are real people that it is happening to. So, with the subject coming under such scrutiny these days, it will help to diagnose players with a concussion more effectively and determine their related symptoms and possibly them understand their long-term effects that are now being associated with receiving a concussion. Thank you.